Hello, everyone. So today's topic is about viral infection of the eye. In that also, there are a viral infection like herpes simplex and herpes zoster. Today, the topic is herpes zoster, ophthalmicus. So here, in case of herpes zoster in the eyes, how it is affected. Usually, it is a reactivated latent varicella zoster virus, which leads to infection in the eye. And in that, if you see the symptoms, usually there is a skin rash on one side. Always remember it is on one side. Because all this rashes are along with the nerves, ophthalmic nerves. So rash is there. And in that also, if it is severe, it may lead to lead edema. And if inside the eye, if it is a conjunctivitis, then corneal infection, keratitis. So these are the type of infection in the eye you will get in case of herpes zoster. Now, what are the signs? Signs you will see in the eye, there may be conjunctival congestion, and in cornea also there may be ulcer. And it's a painful condition, even in the skin, because of that rash and ocular corneal infection leads to severe pain, redness, watering, edema. So in that, these are the condition we have to rule out diabetes. So you have to go for a blood sugar. And very important, many cases nowadays we are seeing bilateral herpes zoster. So in that case, usually you will see HIV positive patient. So HIV investigation is also the must. In case of this herpes zoster in the eyes, what are the complications? So in this condition, if there's a corneal involvement, there may be some infection in the anterior chamber like iridocyclitis, which can lead to glaucoma. For a long time, if it is remaining, it can lead to complicated cataract. And even in corneal infection, it may lead to corneal opacity, where new vessels are formed in the cornea. So these are the type of complications you may get, and the vision is reduced. Post-herpetic neuralgia is very common. There's a severe burning pain on one side of the face wherever there was a rash. In case of allopathy line of treatment, we give as oral antiviral and even local application of antiviral on the rash and also in the eye. And according to the complications, we have to treat the patient. Topical corticosteroid, of course, only by examination of the eye, we can start topical corticosteroid along with antiviral. Sometimes there is a recurrent herpes zoster also. In those cases, oral antivirals are continued for at least 1 year with a low dose. So all this happens because of the low immunity. And to increase the immunity, of course, most important, we can always integrate with homeopathy. And after that also for prevention also definitely helps. And we have seen many patients having prevention of herpes zoster.
Hello, and I hope that you can hear me, and I hope that you can see me. And Dr. Pushpa has already shared with you about the whole idea about how there are complications of herpes zoster, herpes simplex, many other viral infections, and how it can affect the eye, causing complications like episcleritis, uveitis, scarring, so many other later sequelae, and so on, even neuralgias, which is quite common. Now, homeopathy has a very deep-rooted treatment available in this. And Dr. Megha, if you can open the slide and write what I'm saying, this will be useful. Also, if you can do that. So the main idea in these cases of herpes zoster is two ways. One is the idea to help in the acute state. So during that time, we have to prescribe based on acute symptoms of the eye. So whatever are the symptoms, there might be a huge swelling, better by warm water. A remedy like Rus tox, Rus vinata will come in. If it's a huge swelling, the herpes is around the eye, better by cold, then a remedy like Apis mellifica may come in. So depending on the acute symptomatology, you might have to prescribe an acute remedy. The other idea, very often, this acute remedy may not help that much. So you have to then prescribe at a much deeper level after taking the chronic history, which means that you have to take the entire history of the person, right from the childhood, right from the patterns from the childhood, understand the chief complaint, understanding the past history, understanding the family history, understanding the fears, understanding the insecurities, understanding the crisis moment, understanding all areas and deeper patterns, deeper miasmatic patterns, and then prescribe very, very deep remedy based on that. And there are certain remedies for that. One of the very important remedies are nosodes, and one of the very important nosodes is a remedy, variolinum. This is one of the remedies we used very often for post-herpetic kind of eye issues and even neuralgias. The other remedy is a remedy prepared from that infection itself. So we can even prescribe herpes zoster 30 or herpes simplex 30. So this is also a possibility that we can often use. Very often you have to study the anti-miasmatic patterns. You have to look at what are the deeper miasmatic roots. Based on that, if you see a strong syphilitic miasmatic base, you might have to prescribe a syphilinum. Very often you don't get anything. Only symptom, night aggravation, history of alcoholism in the family, and neuralgia, nothing else. You have to prescribe syphilinum in such cases. Some cases there is no symptom. Only the patient feels very pessimistic. Something bad is going to happen. My eye is going to go. Think about a remedy like sorinum in such kind of case. So pessimism with eye symptom, another remedy is Morgan Gartner, by the way. Boric writes. You can read about it. This is the bowel nosode. So in such a way, we have to look at possible giving relief in acute, and then also if that doesn't help, give a much deeper homeopathic remedy based on a deeper state. So this is the idea with homeopathy. Homeopathy has very, very good treatment in such kind of health issues. We have treated cases like that. And I hope that more and more we can take benefits of homeopathy in such kind of health issues. You can contact us. We have our contact details. Um, we also offer online consultations, and you can also come in person here in our clinic in Mumbai. And that's all I want to say. Thank you, and let's keep in touch.